A GM assembly plant dominates the working-class city of Doraville, Georgia, which gave us one John Duttenhaver, eldest boy of Wayne and Betty, who were both accountants in the city's working-class economy. Young John was a good student and, more importantly, a good athlete, which brought a wrestling scholarship to the state's flagship university. It was in the registration line that John encountered a woman whose name is lost in the mists of Old Sanford, a woman who made a fateful decision based mostly on the fact that there were others in line behind John.
This lady says, "What's your major?" And I said, "Oh, I have no idea what I want to do for the rest of my life." And she said, "Do you like English or science?" I said, "Well, I like both of them." And she sighed again and she said, "You don't like one better than the other?" I said, "Well, I guess I'm better at science." She said, "You're pre-med."
Many a boy has lost his way as a freshman at UGA. Young Duttenhaver felt the need to test those boundaries as well. It fell to the university's faculty to issue a wake-up call to the not-yet Dr. Duttenhaver.
The advisor, the pre-med advisor, his name was Dr. Plummer, and he said, "John, I can't get you in a Caribbean medical school with a 1.9.
It was the competitive kick in the pants that he needed as Duttenhaver went on to graduate summa cum laude, which got him into the Medical College of Georgia, where he thought he was going to be a pediatrician, until fate's hand touched his little brother, his best friend, Paul.
During my sophomore year, my younger brother, Paul, had been diagnosed with a very rare form of cancer. And he had a mediastinal seminoma. It's a very rare cancer that involves the chest. And the cancer was wrapped around his heart and he had a 17-hour operation. They couldn't get the cancer out. And we were devastated because the surgeon that had operated on him told him basically that this is incurable and your brother's going to die. I was in Augusta, so I go to the radiation oncologist in Augusta, a guy named Arlie Fiveash. And I'll never forget, I'm telling Arlie, so I've already talked to the head of thoracic surgery who says, yeah, it sounds, if they couldn't get it all, it sounds, really dismal. And I go talk to Dr. Fiveash, and he leans over and he opens his file drawer and he pulls out this little file folder and says, "This is my folder on mediastinal germ cell tumors. If you got to get cancer, get a mediastinal seminoma." He said, "The radiation will cure him, he'll be fine." And I walked out of that office thinking, I want to do that.
Out of MCG, he took his medical residency at Harvard. In 1985, he came to Memorial, where a patient opened his eyes to a hole in the process of treating cancer.
I had a patient who had seen Dr. Rudolph, and so I asked her, "What did Dr. Rudolph say to you?" And she looked at me and she said, "You're scaring me. My life's on the line and you guys aren't talking to each other." And I said, "Good point."
If you were a cancer patient and you went to a medical oncologist, you got chemotherapy. And if you went to a radiation oncologist, you got radiation therapy. And if you went to surgeon, you were taken to surgery.
Today at the ACI, cancer specialists from the respective disciplines gather on a regular basis to discuss the best way to treat the patients. That's one of the things that came about as Dr. Duttenhaver and Dr. Rudolph began to rethink their approach to cancer. But as their plan consolidated over time, fate intervened again when Duttenhaver was elected to the Memorial Board, a board that included Curtis Anderson.
So I started to rely on John as a resource as I was trying to learn to become an effective board member at Memorial.
God is in this. Kurt and Libba Anderson were interested in becoming involved more in the community.
With the support of the Andersons, a cancer center began to emerge that would rival the best in the nation.
Our vision was to provide a world-class cancer institute here in Savannah so that our friends and neighbors who were diagnosed with cancer wouldn't have to travel and wouldn't have to go to Sloan Kettering or the Anderson Clinic in Houston or some of the other major cancer institutes around.
To provide that level of care required medical skill previously unseen in Savannah, and they set about to gather it. The get that set the medical world abuzz was Dr. William Hoskins.
Bill Hoskins is a deity in GYN oncology. I mean, if you say the name Bill Hoskins to a gynecologic oncologist in China, they know who Bill Hoskins is. And I had people emailing me from Maine and Seattle, what's going on in Savannah?
What was going on in Savannah was a revolution in cancer care, supported by the unwavering philosophy of Memorial Health.
Harry Swikert was the chairman of the board when I came for my interview here, and he said, well, partner, if you need anything, you just tell me, and I'll get you whatever you need. You come to Savannah, and I'll make sure you never have any, you don't ever go without any equipment. Probably one of the things I'm most proud of is that the institution I work for has never said, no, we can't afford that.
The force of Dr. Duttenhaver's intellect and the strength of his commitment have galvanized Memorial around his vision for the Anderson Cancer Institute.
He's really the cornerstone around which much of the ACI has been built. So we have a tremendous debt of gratitude to John, as does this community.
But there wouldn't be a Anderson Cancer Institute if there wasn't for John Duttenhaver.
Patients on the table, and this actually goes into the breast.
Memorial was first in Georgia and is the only hospital in southeast Georgia with the intraoperative radiation therapy technology that allows a patient to get one radiation treatment, instead of one a day for 6 weeks. So if you're a woman with breast cancer in Vidalia, the IORT would save you 160 miles and 4 hours a day. That single improvement can change a patient's life forever.
And if some women make the choice to have a mastectomy because they don't want to or they don't have the means to come back and forth 100 miles each day for their treatment. And that's a major improvement that we can say to these women, you don't have to have your breast removed just because you don't have a ride back and forth.
I think cancer has such a ring of terror for most of us.
John came over, threw his arms around me, hugged me, and said, I want to talk to you about this.
We felt he was a friend. We felt he was a friend, and when you are dealing with this, you want to have friends, and you want friends to help you.
Where would this community be without Joe Buck, whose wisdom and charm have guided the lives of all of the children of our community?
And then 3.5 years ago, had the opportunity to get to know him as my doctor when I had cancer. I had always said, kind of jokingly, if I ever got cancer, John Duttenhaver was going to take care of me. I didn't know that that was going to be a real occasion for me.
Dr. Duttenhaver was playing golf with the Andersons one day when they told him Barbara Paul's upcoming cancer surgery, a course of action with which he disagreed and said so.
Yeah. I'm very grateful that he saved my life.
When Dr. Duttenhaver prescribed expensive medicine for Steve Hollenberg, Steve asked how less fortunate people were able to afford it. When he was told they could not, Steve and Toby established a fund.
It just makes Steve's memory come alive, and I feel blessed to have been able to do it, and blessed that Steve actually was the one who said, when I get well, I want to set something up to help needy patients, and sadly that didn't happen, but the fund is his legacy.
And in fate's profound way of bringing us full circle, consider the contributions of Kurt and Libba Anderson against this backdrop.
Little did we know that both of us would end up being treated here in Savannah, me for prostate cancer and Libba for breast cancer, and that John Duttenhaver would be our physician in both cases, and that he was the early visionary for the whole concept of a cancer institute.
There are thousands more. Thousands of lives touched by his creativity and his knowledge and his determination.
But I've been the brother who's sitting in the room wishing you could make your brother well. And so, oncology is where I should be. It was the best choice for John Duttenhaver.
And then there's the matter of his compassion.
When I was diagnosed with breast cancer, he was my call. I went right to him, and he put me at ease, and he is the kind of doctor who will spend hours with you if need be.
A gentleman who's also a compassionate human being that loves life and loves to help other people live life.
What they know is, was the nurse nice to me? Did the doctor explain to me in a way I could understand? Do I feel like I'm a human being in this process that's so dehumanizing? And that's what I tried to do.
Dr. John Duttenhaver is retiring, completing another section in the circle of his life.
In a way, Paul was the reason I went into radiation, and he's the reason I'm getting out of radiation. You know, his death in October of 2011 was just, you know, he and I were going to go play golf together in Scotland when we retired. We were going to go rent a house in Tuscany when we retired. We were going to do all these things when we retired. And when Paul died, it became very clear that there's a lot of things that I want to do that I've been putting on a bucket list. And if you're working 50, 60 hours a week, you're not having time to check off the bucket list.
He'll have a life's work of companions to add to his leisure years, people who know the wit and the intelligence and the soul.
All of the wonderful things that he is, that makes him John, I think he's been able to pass on to a certain degree to my son. And I feel really lucky that I've been able to have a man like him in my life. And I'm happy that I've been able to share him with all of his patients and all of his friends and all the people whose lives he's touched.
Just shy of 30 years at Memorial, years of helping people in their most desperate hour. This is what he would have you know.
I've been here 28 years, and I've tried to show up for work every day and do a good job taking care of patients. That's been my mission, is to take good care of patients.